The biggest vaccine rollout this country has ever seen. There was a major dry run in Phoenix today. A hospital actually practicing how to keep the vaccine cold and how to vaccinate people in their cars. And new questions about the Pfizer vaccine tonight. If it's not kept cold enough, what happens to its efficacy? Here's our chief national correspondent, Matt Gutman, from Phoenix tonight.
Hi there.
Hi.
Hi there. What's your name and date of birth?
This vaccine dry run is as real as they could make it.
Can I have you please roll up your sleeve?
Sterilization, real syringe, the change of latex gloves. HonorHealth in Phoenix, one of dozens of sites around the country that starting mid-December will serve as a mass vaccination hub for healthcare workers and first responders like these Phoenix firefighters we rode with in July.
You're
I'm
sanitizing after
my hands.
So you're trying to go through the
I'm
paces.
trying to make this as real as it's going to be.
Now, they've cycled through about 50 cars so far, but when they get the real vaccine, all of these lanes are going to be open, and they hope to get through 1,500 a day.
The Pfizer vaccine will be stored in these special freezers under tight security.
The vaccine will be kept in a secured room, which is within a secured building, which is on a secured location.
After each vial of the vaccine is thawed, a chemist will dilute it with saline and divide it into 5 doses, which must be injected within an hour.
No playbook. The team has put this together and created it based on a lot of unknowns.
Neil Browning got the Moderna vaccine nearly 9 months ago when he volunteered for the trial.
I experienced nothing other than a very mild sore arm the next morning after each injection, much like you would have with a typical flu shot.
Moderna and Pfizer say the side effects from both the vaccines have been mild. Little is known about long-term side effects, but Dr. Anthony Fauci says 90% of adverse effects from vaccines show up in the first 6 weeks. COVID vaccine volunteers have been monitored for at least 2 months.
So right away, they will have captured the overwhelming majority, historically, of when you see so-called long-term side effects of a vaccine.
All right, so let's get right to Matt Gutman live in Phoenix tonight for us. And Matt, we know the Pfizer vaccine needs to be kept at 94 degrees below zero. You've showed us the freezers. What happens, though, if it's not kept that cold?
David, as you mentioned, it's an incredibly delicate vaccine, and if it gets too warm, then that vaccine becomes unstable, therefore unsafe to use, meaning that dose has to be thrown away. And remember, this is the first time in history that an mRNA vaccine has ever been used.
Yeah, this is going to be really tricky as we try to get this out across the country. In the meantime, on the Moderna vaccine tonight, new findings from patients in the trials now 3 months after their second shot of the Moderna vaccine. And what are they seeing?
Basically, they have examined people who have had that second shot of the Moderna vaccine, as you've mentioned, and they found that their antibodies persisted in the system for 3 months, essentially mimicking the body's immunoresponse to actually having the virus. That's very encouraging news, but what scientists are still trying to investigate is how durable that protection is, meaning how long the immune system can keep fighting off the virus.
Yeah, that's the question, but the fact that they saw the antibodies 3 months later is really good news tonight. Matt, thank you.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.